Good evening, everyone. Welcome back to You and Your Health. Thank you for tuning into our program this evening. My name is Erica Hilton, the co-host of this program, and my other co-hosts, Dr. Edward Usuman and Dr. Yvonne Palampuda. Are you all there to say hello? Welcome back.
You.
Thank
Uh,
you.
Dr. Eddie, I know you're excited to have this program this evening.
Yeah.
Because of the topic, it's men's health, not
Mhm.
necessarily reproductive health, but men's health. So were you able to share the flyers with people?
Yeah, we share the flyers, and I think the questions were coming from the women rather than the men. So we may have more questions.
Well, that would be good. Well, I'm glad that Dr. Sapri J is back with us for this segment. And her first segment was on prostate cancer last September.
I
So
remember.
yeah, so in case people who are watching haven't watched that segment, then we will ask them to please go ahead and watch it. I guess because of time, we can go ahead and get started.
Okay.
Thank you. So as mentioned, this evening's series will be on reproductive health. Today's discussion will focus on male fertility and infertility and fertility preservation. We are planning a section on female reproductive health and hopefully in the coming months. So hopefully you'll be able to tune in. Nearly 1 in 7 couples is considered infertile. And in up to one half of these couples, male infertility plays a partial role in the couple not conceiving. Male infertility accounts for nearly 49% of couples not conceiving. So it is not always the woman's fault. And so I'm glad that Dr. Suffrage is here to share some light on this topic. The topic is very much overdue, and so we're glad that she's able to present this evening. So to tell you a little bit about our speaker, as I mentioned, she was on the program in September and had a discussion on prostate cancer. Dr. Denise Suffrage is a urologist and assistant professor at Loyola University Medical Center in Chicago, Illinois, where she serves as the director of male reproductive medicine. She completed her specialty fellowship training in sexual dysfunction and male infertility at the University of California, Los Angeles, UCLA. Dr. Suffrage completed her urology residency at the Columbia University Irvine Medical Center, and received her medical degree from the University of Michigan Medical School. She obtained an MPH, which is a Master's in Public Health, in Health Policy and Management from the Harvard School of Public Health, and a Bachelor of Science degree from the Carnegie Mellon University. Dr. Suffrage is a proud first-generation Ghanaian American, hailing from the Bronx, New York City, and is passionate about global health and global healthcare and outreach in Ghana. In the future, she aims to utilize her clinical research to help healthcare systems achieve access to equitable and high-quality healthcare for sexual dysfunction and male reproductive services. She enjoys lecture and also leisure time traveling around the world, musicals, golf, exercising, and cooking. So let us welcome back our guest, Dr. Denise Suffrage. Hello, Dr. Suffrage.
Hi, thank you so much for the warm welcome and introduction, and thank you for having me back. I had a blast last time we did this program, so I'm looking forward to kind of focusing on, as you said, a really, really important topic that really needs to be discussed more in our communities.
Yes, thank you so much for accepting our invitation as well. I know your schedule is busy. You're currently on call, so I promise that we will try not to keep you for too long as we discuss this topic. So, Dr. Eddie, if you're ready, if you don't mind projecting Dr. Suffrage's slides.
It's funny, after I did this program last time, I actually have several family members in Ghana who are in the Ghana Methodist Church and they hit me up. They're like, I didn't know you were giving a talk.
So what we do is we kind of post a flyer everywhere. And so I
Yeah.
just sent it to a couple of the pastors in Ghana now. So hopefully they were able to disseminate that as well. So
Yeah.
we are ready for you whenever you are.
Okay, awesome. And as Ericia mentioned, I'm going to be talking about male infertility. And she already kind of talked about where I'm at. I'm at Loyola University in Chicago, Illinois. And I also have a dual appointment in the School of Public Health here. So a lot of my work and interests kind of mesh urology and public health. Next slide. So I wanted to first talk about the landscape of male infertility. It was already kind of briefly mentioned what the statistics look like around how many people are affected by infertility. So infertility affects about 15% of couples worldwide. I think it's important for people to understand the demographics because even two completely healthy people, 15% of the time still have issues conceiving. And so I think it's important, even if, again, two healthy people, you still may run into issues conceiving. So I think it's important to think about. Male factor infertility exclusively accounts for about 20 to 30% of infertility cases, but contributes about 50% of infertility cases overall. And so, as it was also previously mentioned, about half the time males are involved in any issues pertaining to infertility. And I think this isn't just something that's an issue with Ghanaian culture, but really most cultures around the world. Here in the US, just men in general through the centuries really have not been primed with the fact that they could have fertility issues. And I think we are now just starting to break away from that stigma of women having to take the burden on that it's just them, because oftentimes, the men have some contributing factor. In North America, male infertility accounts for about 4.5 to 6% of men, and global rates of male infertility ranges from about 2.5 to 12%. Next slide. So quantifying the true numbers is for male fertility is actually quite difficult for a couple of reasons. So as I mentioned before, cultural and societal and historical trends still trend toward the fact that it's quote unquote the woman's fault. So a lot of men aren't exactly even completing surveys or anything like that, which really helps us to get a sense of how many men are affected by this. So that really affects the numbers. So even though I gave you that range before, we actually suspect that the numbers are much higher than we think. Religious beliefs also contribute to issues with accurate, documentation of male fertility, because there still are lots of religions around the world who don't even think men can be affected. So if you think about those men who also don't go in to either get tested or get diagnosed with male fertility, we end up missing, like quite a bit. There has also been really various definitions of infertility across different studies. So that's also made it hard to really quantify how many men are affected by this. And then finally, male infertility is not really viewed as a disease. So this also contributes to the fact that, people are not getting counted, but it is a disease. Male infertility usually stems from, a wide variety of health issues, which I'll talk a little bit about, but it is a disease. And so I think if you kind of have that framework, it does help us to think about getting more guys in to actually get treated. Next slide. This is actually just a map from a paper by Agarwal et al. That shows a regional breakdown of male fertility trends around the world. These are again in total, how much guys are contributing, to infertility. You can see that those rates are slightly lower. So I mentioned in the U.S., male fertility contributes up to about 50% of infertility cases. And then you can see in Africa that those numbers are a little bit lower, as well as in Asia and other places. The thought is that in some Western countries or more developed countries, that they are doing a better job of quantifying the numbers, and that we still have a long way to go, on the continent of Africa, Asia, the Middle East, what have you, in terms of really pinning down how many men are affected by this. But as I mentioned before, a lot of men are usually not volunteering to come in and admit that they have this. Next slide. So I wanted to give you a broad overview of major causes of male infertility. And it's important that for the men out there, when you seek treatment or work up for this is, for me as a urologist who specializes in this is just a broad sense of major, areas. Of course, there's a lot more than what I've listed here. And I just really tried to list some of the most common ones that we encountered. So we think about anatomic. Varicoceles are actually the most common anatomical cause of male infertility. They're essentially like varicose veins around the testicles. They change the temperature on the testicles, which affects sperm production. And about 40% of the guys I see with infertility have, some kind of varicocele. So it's actually pretty important. And urologists, of course, know how to test for this. So that's why, especially in men, I really, really encourage them not to just use their, wife's doctor and, get diagnosed, because you really need someone who knows how to examine male organs to be able to diagnose this, because this is actually a reversible cause. Undescended testicles. When you're born, your testicles should be in your scrotum. That's the proper place where they need to be for appropriate development. If guys don't have testicles in the right place, it actually, again, also affects sperm production, and that can also result in male infertility. Finally, vasectomy status. Of course, I'm not running into a boatload of African men who've had vasectomies. I'm working on it. But, of course, if you've had a vasectomy, you have blocked off the connection for sperm to get out of your body. So that's a common cause. And you'd actually be surprised. I run into a lot of, middle-aged couples who maybe have been married before. They thought they were done having kids. They got a vasectomy. They meet a new partner. Now they want to have kids, but they're afraid to tell their partner they had a vasectomy. And so that's a pretty common cause. And you'd actually be surprised how many men have gotten vasectomies but don't make the connection that it actually blocks sperm coming out of your body. Hormonal causes are also a major cause of male infertility, particularly testosterone levels. So your body needs to have normal levels of testosterone to actually make sperm. And so this is something that we also check if guys are coming in with issues, just to make sure that hormone levels are normal. There's also a few other hormones that all contribute to sperm production, testosterone production, what have you. And so it's important that you have normal hormonal status to actually make sperm. Genetic causes are also a major cause of male infertility, not a minority of cases, but still common enough where in certain men who we are working up that kind of take us down this pathway, we have to rule out genetic causes. So there actually are genetic causes that completely prevent men from actually being able to have children. There are some knockouts with some of the genes on the Y chromosome. So the Y chromosome, every guy has that chromosome. So women are XX in
Mhm.
terms of men are XY. There are certain microdeletions in the Y chromosome that actually can affect infertility and prevent guys from being able to reproduce. So that's something that in a select, subset of men we do check for. There's also chromosomal abnormalities, mutations in the cystic fibrosis gene. Not, the cystic fibrosis gene, not as common in Africans or Black men, a little bit more common in kind of white European men, but still something that we check for. And then gonadotoxins. That essentially is a fancy word of saying toxins that affect the gonads or your reproductive organs. So anything that can affect the testicles. So there are certain, drugs, environmental exposures, biological agents, if you've had chemotherapy, radiation, things like that, those can all affect, your testicles, which secondarily affect your ability to make sperm. Next slide. This is just a table I put together, kind of classifying male infertility. I won't go into them in detail, but I just again wanted to kind of give you a different perspective as to how we think about classifying male infertility. So male infertility, on one hand, is classified as either primary or secondary. So primary infertility means that the man was never able to have, has no kids, never been able to, was never fertile. Secondary infertility, which is also pretty common, are men that actually were fertile at some point or have kids, but now they're unable to. And that can also be for a variety of reasons. So, just as much as primary infertility is problematic for couples, sometimes if a couple just wants to have one more kid and they have issues, it's also considered, again, secondary infertility as something that I manage. Now, for any guy that's having any issues with male infertility, we're going to be checking, your sperm counts or semen analysis. And there's lots of different ways that things can go wrong with your sperm. And so we think about how many sperm cells there are. They need to be above a certain number. I mentioned up there above 15 million sperm cells per cc. And when you get a semen analysis, wherever you're getting it from, they are counting all of this. And so these are all the parameters that they're looking at to give us a good sense of how good your sperm is. Um, we look at how fast the sperm are moving. Sperm can also be alive, and they can either be moving in place or they could be swimming forward. The purpose of the sperm cells, and especially when you think about the way that they're shaped, if any of you have seen on a molecular level what they look like, they're swimmers, right? And we call them swimmers because they're swimming to the egg. So when we look at sperm cells, we need to make sure that they're shaped normally, that they're moving, but that also that they can move forward, not just wiggling in place. So those are all things that we can look under a microscope and get a good sense of what their shape is like, what their speed is like, and whether they're alive or not. And then we also look to see if there's any sperm cells in the ejaculate or if there's no sperm at all. So for guys, just so that you're aware, every time you ejaculate, you may not necessarily have sperm in it, right? So when you ejaculate, actually about 80% of that volume are just secretions from your prostate. And so only about 15% of your ejaculate after you have sex, what you see, actually contains sperm. So I see a lot of guys who are like, hey, I'm having sex, I'm having ejaculate. That does not mean you have sperm there. That's why it's important to get a semen analysis to actually see. In some guys, it's just, a bunch of secretion fluids, but there's no actual sperm in there. So it actually is important to get that tested. And then we think about obstruction. I mentioned before, like an anatomical obstruction would actually be like a vasectomy, where the actual
Mhm.
tube is physically blocked. But sometimes guys have blockages from other things, like cysts or stones or something like that, and those are things we also treat. But then you also have some guys where all of the channels are open, but for some reason there's still no sperm there. So those are all important classifications as we think about underlying causes. Next slide. So, in terms of essential workup for male infertility, and this is something that, if you're going to, your urologist, these are just the basics of what they're going to be checking. There's no medical history that's complete without a full history and physical. So, what I tell patients when you're coming in, get a sense of, as a guy, did other guys in your family have issues having children? Who in your family did have issues? Your mom's side or your dad's side? Do you have siblings? Did anyone have difficulty? I always ask patients, do you have any children in your family that were born with any, developmental abnormalities? This all gives us a sense of where potential issues could be. So family history is very important. I know that this can be a very sensitive topic, especially for men, but I think for a lot of us growing up, you may have that one uncle that never had kids. Maybe it wasn't by choice. Maybe he actually, couldn't have kids. Or, if you're an only child and, your mom told you that, she had like, a lot of early pregnancy losses. Those are things that are important for us to think about where the source could be. We also get, several lab tests. So FSH stands for follicular stimulating hormone, and that is actually secreted from a part in your brain, the pituitary gland. So the pituitary gland actually, secretes a bunch of hormones that send signals down to the testicles to make testosterone and to also make sperm. So we actually look at, these hormone levels to see if it's normal. Typically, if it's abnormal, it gives us a better sense of where the problem could be along that pathway. But male infertility is really dependent on hormones, so that's something we check. Testosterone is also something that we look at. As I mentioned before, you need normal levels of testosterone to make good sperm. And then finally, a semen analysis. So the rule of thumb, if you get one normal semen analysis, you're probably fine. We typically will repeat it if there's been abnormalities on the semen analysis. I know that there are several, great places, in Ghana and in stateside as well, where you can easily get a semen analysis. Now, a lot of companies can even mail it to you, so it's even a little bit more discreet, and you could do it at home. But that's essentially our window into your testicles. And so, your semen analysis is really, really important for us to determine where the issue could be. Next slide. And then I just wanted to briefly mention some alternatives to conventional conception. I think this is also something that we shy away from in our culture, and I think also just most men. There are different ways that you can achieve your family, and sometimes if it's not happening, quote unquote, the natural way, there's also other technologies that can assist with hopefully getting you, the child that you desire. Intrauterine insemination, and I won't go into too much detail with these first two because my friend who's actually going to be joining you over the summer, Dr. Bay, deals more with female infertility, and they're actually the ones who do this part of the process. I usually will just at least get the sperm for them, but a lot of the technical aspects of assisted reproductive technology is actually done by the female fertility doctors. Intrauterine insemination actually is a nice first step, especially if you've been trying for a while, haven't had any success. That basically entails taking ejaculated sperm from the man and then in an office setting, just putting it right into the woman's uterus. it's nice in that sometimes if your swimmers aren't quite, able to get up the vagina and into the uterus, you kind of overcome that barrier. But it is something that if you have sperm in your ejaculate, most fertility doctors will try and see if that will kind of help achieve a pregnancy. Because once it's in the uterus, now you've kind of given them a head start to be able to then, swim over to your eggs and hopefully fertilize one of them. In vitro fertilization, or IVF, is really kind of the big guns, so to speak, of reproductive technology. The nice thing with in vitro fertilization is that all you need is one sperm. They've gotten very, very savvy in being able to, again, help overcome other barriers that people may have in terms of conceiving. So even if you have maybe, let's say, really low sperm counts, at least if you have one or something there, it can work with that. And again, all you need is one sperm to fertilize one egg. So it does kind of take out of the picture people who may have challenges with sperm count and other things. Because for intrauterine insemination, you do need a minimum number of well-moving sperm for it to work. So if you don't meet that minimum, then you are looking at IVF. Donor sperm is another option that's really not discussed as much. It's probably very underutilized. I do have several patients that, for whatever reason, we've done the maximal workup, we've tried everything, and they just don't have sperm. But they still want to have a child that looks like them, potentially someone that even culturally or genetically is similar. So I do have patients where I counsel them on this, and I say, hey, if we have to go down that route, some people may utilize a sibling, maybe someone in the family that looks like them, so that at least even if it's not their sperm per se, they still have a child that looks similar to them, or at least has some of their genetics, which is important to a lot of people. But it can be done, and it's something that I think is just really not used as much. And then finally, adoption. There are millions of kids in this world who don't have parents, and I think if you don't get to, kind of have your family the way you want to, adoption is also a great, great option. I think, again, a lot of kids need parents, and everyone's family and everyone's story is going to be a little bit different. But I think also another option that's really underutilized. And I think those are the end of my slides. So I put
Okay.
my Twitter and my Instagram handle there for those of you to follow me, and then be happy to take any questions about anything I talked about or anything related to fertility.
Thank you, Dr. Sefri J. So, Dr. Eddie, if you have any questions from viewers, please feel free to post them at the bottom. I have a couple of questions for you.
Mm-hmm.
So, you spoke of inherited disorders. So, I was wondering whether, because I read that sickle cell, um, it could be viewed as a chronic illness that can contribute to infertility. I actually never knew that. I have heard of men who don't necessarily want to have children if they have sickle cell disease. So I guess the thought of just not having children, it's not really just because they don't want children, it's because this could be passed on to their child. But I had no idea there was actually could cause infertility. Are you able to expand on that? How sickle cell can cause infertility?
Yeah, so sickle cell can cause infertility because the blood cells aren't normal. The thought is that you are not maximally getting the blood flow to the testicles, and so that over time can cause issues around sperm production.
Okay. You also mentioned about the fact that you all look for sperms to be swimming forward.
Hmm.
I read that sperm could swim backwards into the bladder, retrograde ejaculation. How can that happen?
So that's a little bit different. So it's not that the sperm is swimming backwards. So with
Okay.
retrograde ejaculation, it's that normally when you ejaculate, there are certain muscles that open up and that they're closed so that your ejaculation is going in one direction. With retrograde ejaculation, specifically, your bladder neck closes when you ejaculate. When you have retrograde ejaculation, your bladder neck is open. That's why instead of the sperm moving forward, now some of them are basically being shot into the bladder. But it's not that the sperm cells individually are swimming backwards. It's
Okay.
that channel. So you could think about if you had a pipe open, if you shifted the direction of the pipe, now everything's going to be going in that direction. Your body's natural mechanism for ejaculation is for it all be coming out of the urethra. but certain medications and even certain conditions, usually diabetes, can actually cause that channel to be open when it's not supposed to be. And that's why the sperm is shot up back into the bladder.
Okay. So
And
with
it's not
one,
dangerous or anything, but it doesn't, it with retrograde ejaculation, and some guys are still getting some ejaculation, or some can actually still get some ejaculate coming out in the right direction. But for some guys that nothing is coming out normally when they ejaculate, we have to first confirm that they even have sperm with what we call a post-ejaculate urine study, urinalysis. And once we confirm that we have sperm there, we can kind of figure out again the best way, basically from their urine sample, to kind of spin down and isolate the sperm that's sitting in their urine. So it's just like an extra step.
so they wouldn't necessarily, the patient would not necessarily know they have that without
Most
the
guys will know if they
urinalysis.
have retrograde ejaculation. It's a pretty obvious sign, especially for guys that know that when they have sex, they see their ejaculate and they don't anymore. It's usually something that is pretty alarming to them. So
Mm,
most guys, if they have a very minor retrograde ejaculation, they may not notice it. But if they have like no ejaculation and they used to, it's usually pretty noticeable, and it usually brings guys into the office pretty quickly.
okay. Okay. Back to Eddie. Can you hear us? I'm going to keep asking questions until he has something to
Yeah.
post.
So a question came up as to whom would you recommend fertility preservation?
Good question. So, I think, especially in the last like decade or so, a lot of fertility preservation has been pushed on women. Like now, egg preservation has, really been more of a hot topic, for women who are now working more, starting their families a little bit later, and just still want to have the security that they have younger eggs ready to be used in case they're not able to maybe conceive naturally at a later time. It's not really pushed as much on guys. And I think that's something that I'm hoping to shift the next couple of years, because guys are also, having kids later. And the same way that women have advanced maternal age at like 35, advanced paternal ages also exist. Actually, advanced paternal age is considered 40 and up, which a lot of guys don't know. So even though men and women can, in theory, have kids, yeah, I guess as long as they want, a lot of people tend to focus more on the fact that women can't have it past a certain age. But after like 40, guys who are, that are having kids, there are higher rates of mental retardation, autism, other things, and other abnormalities in guys who are conceiving at older ages. So I think for maybe the young guys who are listening to this, if you may not be ready for a while, they also do sperm preservation. Sperm preservation is actually a lot cheaper than egg preservation, only because the egg requires a little bit more of a delicate environment to be in a freezer. Well, guys, it's fairly simple, especially if you have sperm in your ejaculate. Of course, all these different places that store will charge something different, but in general, preserving your sperm is a lot cheaper than it is for us women. So I think that for fertility preservation, if you feel like later in life you may want to have a kid, but you're younger now, why not? You may not even, end up using it. But at least, your sperm today is going to be healthier than your sperm in 10 years. So I think that's something that's probably really underutilized. And also for patients that may have like cancer before they undergo chemotherapy or any kind of treatments, those are also men that I see, and I encourage them to preserve their sperm, because after you get, chemotherapy or radiation, those can have effects on your sperm that may not be reversible. And so it's important that, and most, oncologists will talk to you about this, but particularly for the guys, it's so easy for us to get sperm that before you undergo treatment, I'm pretty aggressive with patients about making sure that they save their sperm before they undergo treatment, so that later on, at least if they want to still conceive, they don't have to worry about any of untoward effects from treatments they had.
All right. So how long can the sperm be stored? Because someone is going for a treatment and the person doesn't want to like have the sperm wasted or something like that. Yeah.
Yeah, years and years. Same thing as eggs, as long as you can pay for it.
You
You
have
have
to
to
pay
pay.
storage fees,
Yeah, you have to
supposedly.
pay storage fees. I think a lot of the research that has looked at the viability after, we've been storing sperm and eggs for decades. And so there's pretty good evidence. I think most people will probably agree that after like 15 or 20 years, maybe questionable how great it is if you unfreeze it. But I think anything short of that is certainly, usable. But it can last a pretty long time while frozen.
Okay, so talking about costs, our community are scared of paying for such activities or such medical expenses.
Mhm.
So how and how much does it?
Cost. That also varies. I mean, I would say, for female egg preservation is usually a lot more expensive. I'd say for guys, I would budget anywhere from about a few hundred to about $1,000 a year.
Okay.
Yeah, but it does vary like lab to lab, but I think if you do want to preserve your sperm, it's important to do your research. There are kind of there's publicly available information around, how many people are using the sperm, research and see if they've had any like accidents or something in the past where a bunch of people like lost their cells. Inquire if they have a generator, meaning if we had a big power outage, do they have a way of, still making sure that they have power so that you don't lose all of your stuff. So I think those are things you want to research on. Here in the States, we have the Better Business Bureau. So you can also look and see if any of these banks, if they've had any issues with patients in the past. I'm not as familiar about the sperm preservation in Ghana. I'm still kind of getting the landscape of things there, potentially maybe bringing it to Ghana. But it is something that will cost. And it's important to just invest wisely and just ensure that it's a facility that has all of these steps set up so that they always have power. And I know that can sometimes be an
Yeah,
issue
it can be
back home.
done. Yeah. No, that was an issue a couple of years ago on
Yeah,
TV here in the United States.
yeah, yeah. So really, really scary, but certainly a possibility. And but the good ones have generators to hopefully counteract that.
So to piggyback on Dr. Eddie's previous question in terms of sperm storage, would they be viable when they get unthawed?
Yeah, yeah,
Okay, because I've read of the eggs not making it sometimes after being thawed. So I'm
yeah.
wondering whether that happens to sperm as well.
It does. It does. And that's why it's nice, of course, the more you can store, the better. So I usually tell people you should assume that in the thawing process that you're going to lose at least half. And so that's why people like to, save more so that if they unfreeze it, and if you assume that just from the thawing process, you're definitely going to lose some, but the more that you have saved, you just have more of a buffer. It's a little trickier in guys who may not have as much sperm. And if they didn't store that much, it's a little trickier with the unfreezing. But if you have tons of sperm in the unfreezing process, even though you'll lose some, you'll still have plenty to use.
Okay. There's a
Yeah.
couple of diseases or illnesses that I never thought could cause infertility in men. For example, recurrent respiratory infections apparently can cause male infertility. Have you heard that?
Not directly. So
Okay.
recurrent respiratory infections are oftentimes linked to other genetic conditions that um, affect how sperm move. And so it's not that just having a recurrent respiratory infection alone, but it's linked to underlying, it's actually called Carter-Hainer's syndrome, where the sperm cells are not moving as well. So that's why it causes infertility. And those patients tend to also have very thick mucus in their respiratory tracts, which is why they have recurrent respiratory, tract infections. So it's like a global issue that's affecting different parts of the body. It's not just like an isolated, someone that has like sinus problems. It's usually linked to like a genetic disorder.
Okay. And then the loss of smell as well.
Yeah. So the loss of smell, that's one of the underlying condition, one of the genetic conditions I talked about. And
Mm.
actually that actually has to do with a genetic condition linked to testosterone levels, but not just loss of smell. Like all of these are linked to underlying genetic abnormalities.
Okay. And then the last one within the same topic, facial hair, like a loss of facial hair, decreased facial hair and body hair. Should
So
they be
that's
concerned?
Well, that's linked to testosterone levels. So in men, testosterone is what allows you to have kind of male secondary characteristics, meaning facial hair, deep voice, mature penile length, full testicles. And so if that's not happening, that does tell us that there could be some underlying genetic condition that may affect fertility. But it's usually because if someone shows us evidence they don't have enough testosterone, you need testosterone to make good sperm. So if it's evident that you likely don't have normal levels of testosterone or testosterone production, we know that that's going to affect your sperm.
Okay. Dr. Eddie's back.
And
I'm sure he
so
has a question.
and so how can a man boost his fertility?
So good question. So I think the first thing that you can do is just leading a healthy lifestyle. It's actually, I think people don't realize the significance of just being healthy on a lot of medical conditions. So a nice, well-balanced diet, exercising, exercise increases your blood flow, opens up your blood vessels. That means you're getting more blood flow to your testicles. A good, healthy diet as well, minimizing like heavy alcohol intake, minimizing like smoking and alcohol are essentially toxins to your body in general, and that includes your testicles. So, I tell people I'm not telling you not to drink, but don't go. You shouldn't be binge drinking or drinking a ton. That affects your testicles directly, but then it also actually secondarily affects your liver. Your liver has to make things that are important for the testosterone. So your body is just a whole bunch of things that actually kind of they're all linked to each other. So affecting one thing, it's like a domino effect of other things that that it affects. In terms of, there isn't any, I would say that's the most basic thing you can do to kind of boost your fertility. There are lots of vitamins that are specifically focused on improving your fertility, that have vitamins that we know really help with optimizing sperm production. So, actually, like folate that actually women commonly take to help with their fertility is also helpful in men. CoQ10, which is basically really like an antioxidant or something that just helps kind of take away anything that causes like stress, kind of like local stress in the body. That's also helpful. But there are several pretty good multivitamins that basically have a combination of vitamins that we know have really good effects on, like on the sperm. But I'd say in general, the first thing you want to start with is really just like leading a healthy lifestyle. No smoking, no drinking, if you can, or just, minimizing alcohol, no marijuana or any illicit drugs. There's still a lot more evidence around how marijuana affects, fertility, but we know that it does affect it negatively. So when I counsel my couples, I just say, hey, if your goal is to have a kid, even if for the next year, just try to have some willpower if you can, and avoid some of these habits that are going to affect things. But also, I'm getting enough sleep. So testosterone is actually made when you're sleeping and when you're sleeping regularly. So when you're not getting regular sleep, that's also affecting your testosterone levels. So just getting like good amounts, anywhere from 7 to 8 hours if you can. I know a lot of people that work are not exactly getting got a lot of sleep, but it is important, especially when you're trying to conceive, that you are getting regular sleep so that your hormone levels can all be normal. And then I see a question in the chat: specific foods that enhance sperm production. No, unfortunately. I think, the day someone discovers that, they're probably going to be very rich, just like the person who discovers the best way to really naturally boost your testosterone levels to a significant degree. But no, no specific foods. I mean, I think, plant-based diets in general are pretty good for your body because they don't deposit all the bad junk into your blood vessels, so you just kind of help to preserve better blood flow in your vessels. Now, not to say, as someone, I am not a vegetarian or a vegan. I like my meat, and so I think it's important when we say plant-based diet. I'm not advocating that you be a vegetarian. I'm just saying, if you're someone who eats, red meat 5 days a week, try to switch out one or two of those meals with like spinach stew or something meat, but just try to have, with most of your meals, some servings of, some vegetables, and just, switch up your protein a little bit, red meat, try to maybe have some fish if you like fish, and just kind of switch it up. But a well balanced diet, it really is something that tries to minimize red meat when you can, but it doesn't mean you have to eliminate it.
So what about a gluten-free diet?
I haven't really hopped on the gluten-free diet train, to be quite
Because they're
honest.
saying that folks with celiac disease or digestive disorders could have issues with males could have issues with infertility, and so therefore they recommend. This is from the Mayo Clinic website. So they recommend gluten-free diet
Yeah,
to
I,
help with
I
fertility.
Yeah, no, I personally don't recommend to my patients. I mean, I think celiac disease, it's common, but not common enough where I need to have all my patients on a very special diet. I mean, I think certainly, celiac again is an underlying, kind of an underlying genetic, abnormality. But I don't think you need to be on a gluten-free diet if you're trying to, conceive. For those who have celiac disease, it makes sense because if you are on a gluten-free diet, then you're not continuously activating these stress factors in your body that are causing issues. So I think when those patients, if you keep triggering your body to have like a response to something, that's inadvertently going to have a response kind of, throughout your body. But I think it's totally reasonable just to, again, focus on a plant-based, a well-balanced diet, but it doesn't need to be, gluten-free if you like don't have celiac disease. I think a lot of people have found just, better relief. And, I mean, it's something that's been more in vogue in the last like 5 years, but I don't really think it has any major, effects on fertility. So.
Okay.
So if you are saying that I've been diagnosed with low sperm, so what's next?
Well, one, we'd have to see how low it is to see if that prompts maybe some genetic testing. If they've only gotten one analysis done, they should probably repeat it just to confirm what the finding is. But low sperm is kind of a big category. So I think if they've only had one semen analysis, they should repeat it to just ensure that maybe they just didn't have like a bad day. And if it's still the same abnormality, it would just kind of depend where they fall. The multivitamins for fertility, as I mentioned before, several of them work, pretty well. ProFertile is the one that I typically recommend to a lot of guys. It has pretty good evidence about, helping just with sperm parameters. But there are tons, like Amazon, wherever you go. I mean, a lot of them are pretty good. In terms of, and I've seen guys that have had pretty good effects from that. But for a guy with a low sperm count, this is also why it's important to see a urologist, because I don't know if anatomically there's something contributing to that. So it's kind of hard to just, say, go and take a vitamin and hope it helps, because if you have an underlying cause, especially one that's reversible, we're never going to be able to correct it. You're never going to up your sperm counts if you don't correct the underlying issue. So that's why physical exams are really important.
Okay.
So that person should see a urologist and repeat a semen analysis if they've only gotten one done, just to, again, make sure that, everyone kind of has a bad day, including guys. You also need to, before you get a semen analysis, you need to have been abstinent for like 2 to 3 days. And so, if you went and, if you had sex the night before and then the next day you went to get the semen analysis, you also may have some count issues. So just make sure that you're following those
But
directions.
I think that person has been having a bad day more than once or twice.
Oh, okay.
So let's
They
say
should
Yvonne has
see.
another question in the
There's a
chat as
question.
well. Yeah.
So,
Are,
are
are
men
men
who work in high risk environments such as military and those who participate in high impact sports at high risk for infertility?
Great question. So, high risk environment, I always ask my guys what they do for a living, especially those that work in kind of high chemical exposure, areas, or have had, some exposure to that. That can contribute, so it's something we take note of. But I always ask, current occupation, prior occupations, because we know a lot of chemicals, over time with continued exposure can affect it. The last decade or so, maybe the last 20 years, a lot of these plants are required to have men have protective, gear. I think it was in years prior where a lot of men were just, and even still some places today where people are exposed and they don't have the appropriate workplace protection. So I think if you are working in a place with a lot of chemical exposures or anything like that, you should definitely make sure that you have all of the, that you're continuously wearing a lot of the protective, gear. One thing that I see a lot of like young guys, and that I caution about, your testicles like to be cool. They don't like to be hot. That's why your scrotum is outside of your body. So for a lot of people that are working from home and things like that now with the pandemic, I would try to minimize times that your laptop is maybe sitting on your lap. That can cause the scrotum to be a little bit warm, and over time that can cause issues with your count. If you keep your phone, let's say again, like right on your pants and it's just kind of sitting on your testicle, that can also be, and that can also cause issues. But I would say those high risk environments, military, again, it kind of depends on what part of the military. If you are serving in some area where you are getting continuous chemical exposure and you're having issues, that's something that we can, just try to tease out. Unfortunately, if you've already had the exposure, we can't really undo it. But I think it gives us a good sense of how aggressive we need to be, and maybe you may be someone who may be a better kind of assisted reproductive candidate if we're not having great results. High impact sports, also another great question. Certainly if you think about, over time, if every day your testicle was being, hit and traumatized, like, yes, over time, that can cause issues. If you think about when you get a cut, you scab, you scar. If you have a lot of hits to the testicle, inside the testicle, you're basically having like little bruises or little, micro injuries over time. So when I think of like high impact sports, a lot of them now also do have protective wear. So I think about like here in the States, football, a lot of guys are wearing protective cups. So even though it's a high impact sport, they're very rarely having things that are like directly kind of hitting the testicle. But I think that's also something where you just want to be mindful of something that protects the testicle. So you can still do the sport, but if you know that you're getting hit every single day in the testicles, you may want to protect them.
So I think she put another question. I think you may have alluded to this earlier, but does the quantity and quality of sperm decrease with age for perfectly healthy men? Yes, she actually did
Yes.
say that. And if so, at what age should men consider fertility preservation? I believe you said 40. And
So yeah, sperm quality starts to go down after 40. But I think for men, you just want to gauge what your goals are. If you're already in your 40s and you haven't had kids yet, I mean, you can still go and preserve your sperm and, save it for later. But if you've already finished having your kids, you don't necessarily have to like go and preserve your sperm if you don't really have an intention of using it. So I think fertility preservation can really be done at any age. Most people probably won't encourage you to preserve your sperm after you hit your 40s, just because we know that that quality has already gone down and you're probably better off just seeing how you do naturally. But, I think certainly for guys, 20s, 30s, maybe early 40s, if you haven't done so already, I think it's totally reasonable to, preserve it and just, still potentially use it for, a later time period.
so should they consider preserving if they're considering vasectomies?
If so, with vasectomies, yeah, if they want to get a vasectomy and they want to save their sperm beforehand, they certainly can. I mean, I think that you probably shouldn't get a vasectomy if you still want to have kids.
Right. Think
So
down the line.
yeah, I think if you still want to have kids, something to think about. But there's also vasectomy reversals. I do vasectomy reversals as well. So I mean, I think for guys that if they've changed their mind or what have you, it is possible to reverse it. It's much easier to reverse a vasectomy than it is to reverse, like if a woman goes and gets her tubes tied. It's a much more difficult procedure. That's why I'm actually a big advocate of if you are, if you as a couple want to do something more definitive in a procedure, it's much easier for a guy to get a vasectomy than it is for a woman to get any procedure. I do vasectomies in like 5 minutes, literally 5 minutes, and it's very short just because the male organs are out of the body, so they're accessible. It's much harder in women. So I think for all the guys out there, um, if you want to do your wife a favor in society, vasectomies are much easier. And vasectomies don't take away your ability to have kids. Your testicles are constantly making sperm even when you have a vasectomy. So that's why you can reverse them, because when you reverse it, you're just opening up the tubes again, so to speak. So you're not sterile per se when you have a vasectomy. You could think about it as you've just blocked a pathway, but you still are actively making sperm.
Okay, so you don't see a lot of blockages with vasectomies that in terms of like reversal.
Well, that's also nuanced in that it depends, because everyone does their vasectomies differently. Everyone has had kind of a different, I mean, there's also several different approaches to it. And so, it's certainly possible, but it also, success also depends on, like, how far out you were from your vasectomy, depending on who did it, how much of things were taken out. So there's a lot of things to consider when we think about like vasectomy reversal success, but functionally, it's basically removing a blockage and bringing the tubes back together.
Okay. Okay. Well, thank you, Dr. A. Did you have any more questions before we let Dr. Sufraget go?
No.
You don't have any more
Let me
questions.
see.
And
Questions answered.
okay, so one last question from Dr. Vaughn. Does medical insurance cover fertility preservations for men? It depends. With specific medical conditions, okay, that could result in infertility. For example, sperm preservation prior to undergoing chemotherapy or radiation therapy.
Yeah, I would say they usually do. I don't believe that. So a lot of them, at least for the process, you can certainly justify getting your sperm preserved. I think you may run into some issues depending on your insurance with whether they're going to pay the storage costs. So they may pay for the actual like procedure, but typically patients would have to pay the storage cost themselves, unless, again, you have something worked out with your insurance company.
Okay. Well, thank you as always. Thank you for an excellent presentation. Dr. Yvonne says thank you as well. I'm
Yeah.
sure that our members gain a lot from the discussion, and hopefully the good thing is this stays online. I know some of you are pretty shy to come on and ask questions. So it's going to be online. Feel free to watch it at your own time, on the privacy of your own home, because there's a lot of information that you gave, and we certainly appreciate it. That you took the time to share this information with our viewers. And hopefully we'll have you back soon.
Yeah, no, my pleasure. My pleasure. No, always happy to join. And, feel free to follow me. My Instagram is Dr. Denise _official. So you could just show that last slide. And I usually post, some good content. Men's Health Month is coming up, so I'll be posting a ton on my page. So follow me there and look out for some more information about fertility and other aspects of men's health.
That would be awesome. Thank you. Yeah, Dr. Eddie put it up there. So
Thank
thank you.
you.
Thank you again. And I'll be harassing you in a couple of months for you to come back. So we certainly appreciate it and hope to see you very soon.
All right, sounds good. Well, enjoy the rest of your program. Thanks as always for having me. I appreciate it.
Thank you.
Thank you very much.
Bye.
Bye-bye. Okay, this was a great segment. Like Yvonne, thanks for the questions that you posted in the chat. I know that you weren't able to join constantly, but thank you so much. So we're gonna end our program because it's a church program that you should all tune in. I believe it starts at 8:30. Is that correct, Dr. Eddie?
Yeah,
It
8:30.
starts at 8:30.
Yeah,
Okay.
the John Wesley Week celebration.
Okay. Thank you. So as always, feel free to share this program with family and friends so they too can benefit. As I mentioned, we'll be having another series on fertility, this time on female reproductive health in the coming month. And so we hope that you're able to join in. So thank you again for watching the program and hope you have a wonderful, wonderful evening. Bye-bye.